We're with Doctors Mansker and Miller today at Buford Memorial, and we are having a fascinating conversation. We're talking about surgery, we're talking about robotics. There has been an entire progression of surgery over the years, and both of these doctors have experienced that continuum. And so we're going to start with Dr. Miller today. And you're relatively new to Buford Memorial, but this whole robotics experience is not new to you. Can you tell us about that?
Yeah, 4 or 5 years ago, I moved here from the Charlotte area. My hospital in Rock Hill didn't offer robotic surgery. They didn't have a robot there. But the office in Charlotte that I operated on as well did buy the robot. And I wanted to figure out, what it was about this robot and robotic surgery and whether this was important or not. Went and did all the training and got trained up and certified and fell in love with it. But I fell in love with it because it's a better modality for lots of different surgeries. When a year ago, when this opportunity to come to Buford opened up, one of the biggest selling points for me was that they had a robot, and that was critical. I think it was critical for them. They were looking for somebody who was robotically trained, but it was critical for me as well. And the neat thing is, Buford bought it. I think it was in 2006 or 2007. They were early on the learning curve. And I think they had a CEO who really had vision and saw where this was potentially would go. And as a surgeon, that's where you want to be. You want to be someplace that's going to embrace technology, and that's what I felt like Buford was doing.
Wonderful. And now Buford Memorial is one of the first in the region to actually have this technology and to perform surgery with a robot. Can you talk to us a little bit about the history?
Yeah, they're the only. I mean, depending on the region you're looking at, they're the only. There's a few hospitals in Charleston that have. There's some in Savannah, but there's nothing in the Buford, Hilton Head, area. And so Buford is the only one, at this point. Dr. Mansker is a general surgeon. She does different surgeries than I do. I'm a gynecologist, and so we do different types of surgeries.
Right.
And there's different sort of service lines that the robot's used for. Probably at this point in 2015, the two most popular surgery lines are general surgery and gynecology.
Now, tell us a little bit about how the robot works.
Well, it's interesting because that's one of the first questions that patients want to know. Because they always are scared that, we're going to go get a cup of coffee or go play golf and that we leave the robot there and the robot does everything. And what if the robot messes up and, who's there to fix it?
Here are two of my partners, Doctors Chris Benson and Claude Tolbert, in the Buford Memorial OR with the robot.
And so really what happens is, it's very similar to, sort of traditional laparoscopic surgery in terms of, where you make your incisions, where you put your ports. And you do all of that stuff, you're hands-on getting everything set up. Then the robot is a multi-armed instrument that rolls in and you attach it to the different, we call them ports, where the instruments are going to go through. You attach it there, then the surgeon actually technically leaves this sterile field and steps away to a console. And in that console, with various foot pedals and sort of manipulating their hands, then they're able to move the instruments that they've placed in the patient.
So if I'm understanding what you're saying, this is actually increasing precision.
Definitely. Not only precision, precision accuracy, from a surgeon standpoint, the visibility is far superior. And when you're talking to patients, you say, listen, I always tell people, I'm old enough that I remember when you'd watch football games and just standard TV. And then once you got high definition, you could never go back to watching standard TV, any sporting event. This is sort of what it's like. You do standard surgery and you go to the robotic and your ability to see things because it's magnified tenfold and it's HD. It's just superior. And it's funny because sometimes you're in there and there might be a little vessel that's bleeding and you look and go, well, that looks like it's bleeding a lot, and you realize, well, no, it's barely bleeding at all, but I see so well, it looks.
You've adapted to the technology.
So it does. You are able to see a whole lot better. The dexterity of the machine is really better. We can put our hands in spots that you just physically can't reach otherwise.